And here is the second video to check your comprehension of real people in the UK. Over to Christine, who's a psychosexual therapist.
My name is Christine Kirkham and I am a psychosexual therapist. So my background, my working background was in nursing, so I was qualified as a nurse. And then when I left nursing to have my second son, I then went on to train firstly as a couple counsellor, and I did that with an agency called Relate, who work with relationship problems. And following completing that training, I then went on to train. I did a diploma in psychosexual therapy. So that work is about, the initial qualification was to work with couples who've got communication problems and general relationship problems, and then following that the training was to work specifically with sexual problems. It can be quite boring, and also working with couples, if there's a lot of conflict in the relationship, that can be difficult. People often might spend an hour in front of you arguing, and it may be difficult to do your job properly because you're not able to get in and sort of offer any interventions if they just sit and argue in front of you. So that can be really quite difficult. I do find it rewarding. I particularly find working with couples with sexual problems rewarding because quite often they're very motivated. They have usually got a fairly good general relationship, and so that can be really rewarding. And I guess one of the most rewarding things is quite often, I see couples and they may end up having a child, which would not have been a possibility if they hadn't resolved the sexual issue. And sometimes people may say that if they hadn't come to see me, the relationship may have ended. So that's obviously really rewarding when you hear that.
Okay.
Yeah, sometimes quite a lot of people that access the service. I work for the NHS now. Quite a lot of them may live quite local, so you do have to say to them, if I was to see you in public, I wouldn't acknowledge you. And you have to sort of make that quite clear at the outset, because it would not be unusual, because we live in quite a small town, to actually bump into people during the course. Sometimes in the supermarket, for example, you may see somebody that you're seeing currently, they may be a patient, and obviously you wouldn't make yourself known to them. However, if they were to speak to you, you would then acknowledge them. If somebody was to ask for treatment and you knew them, or you knew somebody quite close to you, then you would have to pass them on to another therapist, because obviously that can be a difficulty in terms of they may be concerned about confidentiality. I like the job I do now. I particularly like the variety that comes with it, because I do half couple counselling, so that would be people with general relationship problems, and half psychosexual therapy. And the other thing that I've got now that I enjoy doing, which is quite new, is I supervise other people that are training to become couple counsellors. So that would be something that I would be quite interested in developing. I did think at one time that I may be interested in training people, being part of the training team, but maybe not so much now. I'm probably quite happy doing what I do. In fact, quite a rewarding part of what I do is if the service that we offer is an NHS service, and it feels like one of my life achievements really, that actually that service is available in Bury, because I have pushed for that service. In actual fact, for the first couple of years that I worked in Bury, I worked voluntary. There was no service available, and in some of the surrounding areas this service is not available, but it's available in Bury. And I like to think that a big part of that, in fact I know a big part of that, is because of the fact that I push for this service to be available. So that feels like quite an achievement. I don't think my children would come to me with their relationship problems, but if they did, I would be absolutely fine with it. I think talking to friends, I think that my children are fairly open with me, and I hope that might be part of, because of who I am and maybe what I do. But equally, I would obviously respect their privacy and would try not to intrude. But I think there's a level of openness, and that may be in part because of what I do.
At one point, Christine says, near the beginning, I went on to train means I then started to train. So she was doing one thing and she continued on to something else. She also talks about couples counselling. Couples counselling is what a counsellor does. A counsellor is a person who listens to people talk and then gives advice about their problems. So in this case, this counsellor is giving advice to a couple. Couples counselling. He is counselling a couple. Or in this case, Christine is also a couples counsellor. Now, when you argue, you speak strongly to somebody because you disagree with what they are saying. So when you argue with your boyfriend or girlfriend or even with your parents say you can't use the car tonight and you really want to, you disagree, and so you argue with them. You give your reasons for wanting to take the car in a very strong way. Now, Christine says you're not able to get in and help. This means interrupt and jump into the conversation to give her advice when two people are sitting in front of her arguing. Because as you've seen on television, unless you've been in counselling, you see the two people and sometimes you can't interrupt them and they just keep going on and 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 on, and you can't jump in, you can't get in to stop them, to give them some advice. When you find something rewarding, you feel satisfied with what you did. What you did created a nice sensation and now you're happy about it. You find it rewarding. Now, fairly good means more than average but less than extremely, than very. So it's fairly hot today. It's not cold and it's not really hot. It's fairly hot. To end up means to arrive in a situation at the end. So for example, my dead horse will probably end up being turned into dog food. The NHS is the National Health Service. To live local means to live nearby, close by. Do you live local or do you live far away? Where I'm filming now, I do not live local anymore. I used to live local to this office and now I don't anymore. I don't live local. To see somebody in public. Christine was talking about when she's at the supermarket or out in public and she sees some of her patients. To see somebody in public means to see them outside of the office where she works, the surgery, the clinic. So if you see somebody in public, you see them outside, not in your home or in your office. At the outset basically means at the beginning, at the start. To bump into somebody. I like this. I bumped into my ex-girlfriend at the supermarket. It means I was in the supermarket and accidentally, by chance, I had no idea she was going to be there. I turned the corner with my trolley and banged into her. Now, I banged into her with a trolley. To bump into somebody doesn't literally mean to bang into them. It might happen, but to bump into somebody means to find somebody that you didn't expect to see in a place where you are. You found them by chance. You saw them by chance. When Christine says you wouldn't make yourself known to them, she means she wouldn't say, "Hi, it's me," when she's in public with other people. You wouldn't tell people it was you because the people might be embarrassed. If you see two of your patients in the supermarket, the last thing they want is for you to shout across the cheese or the frozen goods and say, "Hi, it's me, your psychosexual therapist. I'm here. Hi. Yes, everybody, I'm their therapist." Not very nice, is it? So you wouldn't make yourself known to them. To push for something, not in the sense of Danny Minogue's song, Push. If you push for something, you keep asking or keep demanding for something until it eventually happens. To intrude. Now, to intrude means to go somewhere. It can also be into a conversation, but normally to go somewhere into a place that you're not wanted or not expected to be. You see two people in the office, you open the door and they stop talking. "Oh, sorry, am I intruding?" In other words, do you need time alone? Do I need to go away? Should I not be here? So to intrude means to go somewhere that you're not expected to be or wanted to be. A level of openness. Openness just means honesty. It's the same. That may be in part of because of what I do. In part, in this sentence, just means partially, to some degree. So, now you've looked at all the vocab with me, go back to the video of Christine, listen again and see if you can hear these words and see if now you understand better. Remember, not only do you need to press the subscribe button, you also need to press the bell. If you don't press the bell, you don't get the notifications.